Welcome to an interactive video tutorial on medication administration. The purpose of this video is to provide instruction on the various components of safe and effective practice in the clinical setting. This tutorial is separated into the following modules. In front of you, you should have a video guide corresponding to each module. Please feel free to make any additional notes, as there will be a short quiz at the end of each of the 4 sections. First, we will review common terminology you will encounter in the day-to-day practice around medication administration. The MAR, or Medication Administration Record, is a legal record of medications administered to a client. PRN, or as per required need, is medication ordered by a physician that is administered according to a specific protocol. A self-directed client is able to take their own medication. It's the caregiver's responsibility to ask whether they have taken their medication at a specific time. A blister or bubble pack contains medications separated into packaged compartments. Medication storage. Depending on your role in Strive Living, your program will have a unique protocol for storing medication. Please review these protocols on ShareVision or Access Care. All medication is kept in a secured and designated area. This even includes PRN meds. In practice, you will find that medication services may fall into either the support service or prescribed service level. Services at the support level indicate the client controls access to their medication stored within their suite. These clients are self-directed and will be administering these medications themselves, although they may require a helpful reminder. Services at the prescribed level require that all scheduled medications are administered by staff members. These medications are to be stored in a lock cupboard. If you're currently working as a contractor within the Assisted Independent Living program, then all medications should be locked and stored away, regardless of whether you're providing support or prescribed level care. Just as a reminder, PRN and narcotic medications are not found with the regular medications, but are stored and packaged separately, each into a singular container or bubble pack. Also, narcotics should only ever be kept in a locked cupboard. You can expect that medication will most commonly be found in a bubble pack or pouch system. Both the bubble pack and pouch are labeled by the pharmacy with the individual's name, the name of the medication, the strength and quality of the medication, the directions, an expiration date, and the number of refills. Each bubble pack corresponds to a time a medication is to be taken. For example, a medication taken 3 times a day should have 3 separate cards for breakfast, lunch, and dinner. The bubble pack cards are also numbered according to the days of the week or month. Please remember, all medications are to be kept in the original containers. Under no circumstances should the original instructions or labels be modified. This concludes the end of Module 1. Please complete the 5 questions under Module 1 assessment if you have not done so already. Before a medication can be safely given, the care provider must go through 10 safety checks. These are also known as the 10 rights of medication administration. The right drug. Note the name, size, and color of the medication. The right dosage. Always verify the prescribed dosage on the MAR sheet. When pouring liquid, use a medication measuring cup with a graduated range for accuracy. The right administration time. The period for providing your client with their meds is up to an hour before or after the stipulated medication administration time. For example, a medication scheduled at 1400 hour may be given any time between 1300 and 1500 hour. The right route. Read the MAR sheet carefully to ensure the appropriate route is being used, such as by mouth, applied to the skin, or under the tongue. The right client. Make sure the medication is given to the right person using the 2-check system. The right reason. Staff must know the purpose of the medication, as well as the therapeutic effects. The right documentation. Ensure there are standing physician's orders. Only initial and document appropriately after the client has taken the medication. It's important to double-check and match all medications to a corresponding doctor's order. No medications can be given without a written order. This includes over-the-counter medication, herbal remedies, vitamins, and creams. Please remember, care providers cannot be accepting verbal orders. The right evaluation. Check to see that the drug has done what it was supposed to do. This is especially important with PRN meds, as you need to document for the observed result. The right to client education. Please inform the client what the medication is for and how it will be administered. The right to refuse. Every client has the right to refuse any medication. We will discuss medication refusal more thoroughly in Module 5. Next, we will demonstrate how to dispense medication. Start with proper hand hygiene by washing your hands with soap and water. Remove medications from the secured medication cupboard and take out the MAR for the specific individual. Begin the 10 rights of medication administration by checking to see there's a physician's order present. Complete your first medication check by cross-referencing the MAR with the labels on the blister pack. Next, don gloves. For the second check, ask the client to verbalize their name and date of birth. Please do this every time you are giving a medication to a client. Pour the tablet medication from the blister pack into a cleaned cup. Initial the blister pack once you have poured the medication into the medication cup. Once poured, medication must be administered to the individual. Ensure the medication is swallowed. Next, initial the MAR in the space corresponding to the medication date and dosage time immediately after the client has taken the medication. Finally, remove your gloves and perform hand hygiene. If an individual is having difficulty taking their medication, the staff can consult the pharmacist about options that will make the medication easier for them to ingest. This might mean crushing the medication, mixing it in food, obtaining the medication in liquid form, or finding a better time to give that medication. This concludes the end of Module 2. Please complete the 5 questions under Module 2 assessment if you have not done so already. When a PRN medication is needed, ensure the medication is appropriate to the situation, and the client is aware of why they're taking this medication. When you are administering a PRN medication, there is additional documentation that needs to be completed. On the PRN record, staff are required to fill out information on the date, time, route, medication, reason for administration, and observed effects or results. Once you've given the medication following the 10 rights, you can expect to see some effect in 30 to 45 minutes. This is when you can document in the results section about your observation and assessment of the client. Please do not leave the results section blank. Even if 45 minutes has elapsed or your shift is completed, document in the results section. Monitoring is ongoing. Administering narcotics. Ensure to inform the client why they're receiving a PRN narcotic dose. For example, giving a Tylenol 3 for pain. When you are giving a PRN narcotic, you should assess the client's pain before and after administering the medication to determine its effect. You also need to monitor for any side effects, such as dizziness, altered level of consciousness, nausea, or reduced respiratory rate. These results must be charted on the MAR, as well as on the PRN notes, which are normally found at the back of the MAR. If a client is currently living in a licensed facility, they must be deemed competent to self-administer their own medication. This means obtaining written approval from their physician before they're able to independently take their own medication. In this instance, the care provider has the following responsibility. First, check to see if there's a physician's order present. Then check to see if the client has taken their medication. Document S for self-administered on the correct date and time. If a client is leaving the residence, personnel must ensure that any medication they require is dispensed so that the client may take it off-site. Start by dispensing the medication from the blister bubble pack into an individualized vial or envelope labeled with a name, date, administration time, and medication. Once the medication has been dispensed, please initial the bubble pack. Next, place the personalized vial or envelope into a secure container so the client can take it out of the program location. Ensure you have everything you need for the client to take that medication. When administering the medication, remove it from the container without touching it, and if possible, in the presence of another personnel member. Check the 10 rights prior to administering. Upon returning from the outing, the personnel must complete and initial the MAR by writing the number 4 and the correct date and time. Then return the personalized vial to the medication cupboard. This concludes the end of Module 3. Please complete the 5 questions under Module 3 assessment if you have not done so already. When administering medication, it's important to observe the client to determine their reaction to the drug. Please monitor for the therapeutic effects as well as any adverse drug reactions. Adverse drug reactions may occur following a single dose, a prolonged administration of a drug, or the result from the combination of 2 or more drugs. 2 examples of adverse drug reactions include drug allergy and anaphylaxis. An allergic reaction is seen almost immediately after administration. Signs and symptoms include hives, rash, runny nose, shortness of breath, wheezing, and itching eyes. If these symptoms occur, call the nurse or resident's emergency number. A more serious and life-threatening drug reaction that can occur is anaphylaxis. This causes widespread dysfunction of body systems. Signs and symptoms include tightening of the airways and throat, trouble breathing, dizziness, lightheadedness, confusion, a loss of consciousness, chest pain, weak and rapid pulse, a drop in blood pressure, nausea, abdominal cramps, vomiting, diarrhea, or seizure. This warrants a medical emergency. Call 911, verbalize your exact location, who you are, and the client's symptoms. Notify any on-call emergency personnel. If working at a residence, please call the nurse administrator's emergency number. This concludes the end of Module 4. Please complete the 5 questions under Module 4 assessment if you have not done so already. Medication error. When dispensing medication, there are many possible opportunities for error. Some examples include wrong medication administration, providing medication that was not prescribed by a physician and not listed on the MAR, administering medication at the wrong time. Medication was given outside the specified time. Medication was not administered, or a missed medication dose. Unsigned medication. This is usually a missing initial on the MAR. In case of a medication error, please follow the following steps. Either you or a colleague must observe the client to ensure they remain stable. Next, call the pharmacist for advice, explain what happened, and determine what measures need to be taken. Listen carefully, as they may give you instructions to call emergency services. If the pharmacist is not available, call 811 and speak to the pharmacist on duty. If the client begins to exhibit signs of adverse reaction or anaphylaxis, immediately call 911 services. Inform the case manager, on-call emergency personnel, or nurse administrator immediately. If 911 services are required, contact the case manager so that a critical incident report can be completed. Lastly, complete an incident report on ShareVision. A medication incident is when an event occurs despite personnel following proper policy and procedure. The following are considered medication incidents. Refusal of medication. It's within a client's right to refuse medication. However, many of the medications our clients are prescribed are important to their health and well-being. If a client refuses medication, ask them why. Do not force them. Offer medications every 15 minutes until the hour has passed. Put medication away in the client's med cupboard after each refusal. Contact the pharmacy if this is the first time they've missed a dose. Finally, document on the MAR, with an R in the appropriate section. Please document this event on ShareVision. Contaminated medication. When medication is contaminated by coming into contact with non-sterile surfaces, the procedure is the following. Place medication into an envelope and clearly indicate the medication name, date, and dosage. Clearly label with a "Do Not Use" and place in a secure location. Contact the client's pharmacy for replacement medication. Leave a message in the communication book. Administer new medication from the last date of the blister pack or pouch system. If the location is licensed, complete an incident report. Medication is not absorbed. When medication that has been administered as per policy has been either expelled or refused, please contact the pharmacist and follow their directions. You can also call 811 and speak to a pharmacist on call. If the pharmacist directs personnel to re-administer the medication, take new medication from the last date of the blister pack. If the location is licensed, complete an incident report. Missing medication. When medication is missing from the blister pack, and the care provider is certain the medication has not been administered to the individual, then the personnel should administer a new medication from the last date of the blister pack. Next, please call pharmacy to replace the medication and complete an incident report on ShareVision. After any medication incident, be sure to submit an incident report to head office and document the event on ShareVision. As you can see, effective medication management is more than performing the task of dispensing medication. It requires that you, the professional, actively use your knowledge, skill, and judgment to provide safe and competent care. This concludes the end of Module 5. Please complete the 5 questions under Module 5 assessment if you have not done so already.